Here's our next video in the series of ACL rehabilitation, following an athlete from surgery all the way back onto the field. We're now in week 4 of this process, and we can see that our goals are to get full knee extension, to improve quad strength in the ranges seen, begin some proprioceptive exercises, and build a cardio base with non-impact cardiovascular conditioning activities. When we start looking at gait education, the main thing we want to look for is symmetrical weight bearing during stance and making sure there isn't any excessive trike clean, hip hike, or hip drop on either side. We also want to look at the knee during stance to look to see if they demonstrate terminal knee extension and if they have symmetrical step length. We can see here that Maddie lacks terminal knee extension at heel strike and throughout stance phase. As full knee extension is imperative for normal gait, we'll now incorporate prone hangs and deep tissue mobilization with instruments such as the SASTM tools to elongate the tissues and help gain full knee extension. In this video clip, you can see the SASTM tools being used on the hamstrings, the posterior knee, and the gastrocs to help lengthen the fibers. You can see the tissues becoming red as blood flow comes to the area, and with any deep tissue technique, this isn't very comfortable. We're also going to start working on exercises to work into this new range of extension. A lateral box step is seen here as one technique that can be used. We have them use something for balance because they still don't have good balance. And we also want to look for their alignment and make sure the knee doesn't go into valgus as they go into flexion. Here on the side, you can see that we have Maddie going into full extension, tightening the quad and squeezing the glute at the same time to bring the hip and knee together. When this doesn't work to the extent that we want, we'll go back and do a little bit more soft tissue technique and then go into something like a terminal knee extension with tubing and working on some gait education on the treadmill. Here you can see some single leg gait on the treadmill, working on heel toe transition and also tightening the quad to push the knee into extension during stance phase. In slow motion here you can see that as she comes through and her heel contacts the ground, she's still missing a little bit of terminal knee extension, and she doesn't get this extension until just before the heel comes off the treadmill track. This leads us to have to work on this a little bit further in the coming sessions, and really is one of the main focuses of rehab at this point. Without normal or full knee extension, it'll be impossible for them to demonstrate a normal gait pattern, makes that leg shorter, and puts more stress on the hip and pelvis. We'll also work on some TRX squats to work on the quad strength. We're going to look on symmetrical weight bearing as they go down in this position, make sure they're not favoring the surgical side. And when we do things like the leg press, we'll also want to limit the motion to 60 degrees of flexion per MD's guidelines. Here's another exercise on the shuttle we use to work on quad strength and knee extension. Now, summarizing week 4, we were able to progress to full weight bearing. We increased knee flexion, but weren't able to get terminal knee extension, and we started developing good strength base. Now, looking forward to week 5, our main focus is to get terminal knee extension so that we can help normalize gait, improve quad strength, and control inflammation. If you have any questions about anything seen on the video this week, please post it on the forum. Thank you.